Good morning. It is Thursday, August 26th. Welcome into the Morning Medical Update. COVID cases continue to go up, and hospitals, as we know, are overwhelmed. Today, we are going to hear from 3 other area chief medical officers here in the Kansas City area. How are they handling this increase in cases? We talk about their concerns and the challenges that we are all facing as the COVID numbers continue to climb. So before we jump into that, we do want to quickly tell you about a free vaccine event happening this Saturday at the City Market. The KCMO Health Department is encouraging anyone who has not yet received their vaccine to come down to the City Market area from 10 to 2 this Saturday. Just look for the KCMO mobile vaccine truck. It's right there in front of the big paddle wheel near the Farmers Market Pavilion. All 3 vaccines will be available. Second shots will be available. And you can also schedule your second shot through the KCMO Health Department. And if you're getting your second shot, don't forget your vaccination card. So there is the information there on your screen for that. Before we jump in with questions, Dr. Hawkinson is joining us with the COVID count today. Good morning. How are you?
Hi. Good. Today at Hayes, they have 13 active patients, so total of 13 for that, none in that recovery phase. We here at the health system have kind of really been now for the past week or so in that mid to low 60s. We have 63 active infections with 28 ICU patients and 16 on the ventilator. We did have 2 inpatient deaths here at the hospital on 8/25 as well yesterday. So,
all right, thank you for that update.
So a total of 101. They just say we haven't been over the century mark for a while.
38 in that additional recovery period. I'm sorry. Yep.
Total of 101. Ugh.
All right, we're going to get to reporter questions. Can you kick us off with a few words this morning?
Yeah, get vaccinated, wear your mask, and all those good things. A couple of kind of interesting updates first. Long discussion, lots of papers yesterday in the New England Journal of Medicine that were published around vaccine-induced thrombotic thrombocytopenia and therapy for that, but also articles looking at the incidence of side effects with the vaccines versus COVID-19, and a nice audio version. All that's free and open to the public, by the way, and I really encourage you, when you, instead of looking at all the internet science, go listen to some of the stuff, especially the audio interviews on the New England Journal website. They're really good, and I think they're listenable for just about everybody. They're really geared that direction. And I think with the information what they're showing is clearly that vaccines, even though there are side effects, right, the side effects are incredibly rare, and they are much safer than having COVID-19, without question. And the side effects like myocarditis, it gets talked about a little bit, is far more common with COVID-19 than it is with vaccination. We hit 100,000 hospitalizations yesterday with COVID-19 across the United States. That's the first time in a very long time, like since January the 30th, we've been at that number. So we're seeing it continue to climb. And, we looked at modeling yesterday for Kansas and Missouri, and I looked at Johnson County, Wyandotte County, Jackson County, Cass County, Clay County, Douglas County. What you're seeing is there is a leveling off, right, of the new caseload. So that's good, at least the new positive test. But hospitalizations are still rising. And the other thing, and I know we're going to talk about this a little bit, deaths are still rising. And that shouldn't surprise any of us because COVID-19 is bad, the Delta variant is bad, and we all know how to prevent that. We know how to prevent severe illness and death, vaccination. We know how to prevent transmission, masks. And I think, those are really the take-home messages, and we're seeing it all around. Also, some important updates coming out of the Biden administration where they're suggesting that instead of 8 months after your second shot, boosters will be starting 6 months after your second shot. So I think we're going to probably see that pop up in the very near future. I don't know, Hawkeye, anything else you wanted to throw in?
No, we still get questions about, well, I see the vaccine isn't effective and it's not efficacious, it doesn't work. I think you have to go beyond that headline and you have to ask, what are they talking about as far as efficacy? Is it just mean that the vaccine doesn't cause you to have any symptoms, that you don't get the actual virus if you are in those high-risk situations? Or is the efficacy about protecting you from hospitalization, severe disease, and death? Because all of the current data, all of the current articles, which again are all freely available, if you look at things like the CDC MMWR, if you look at the New England Journal of Medicine, just as Dr. Stites said, if you look at the journal Clinical Infectious Disease, all of these peer-reviewed journals that have stringent rules on how they are able to make their articles publicized to people, they are peer-reviewed, so they are critiqued scientifically. And The main issue with all of these recent articles about the vaccine efficacy is that they still protect very well against hospitalization, severe disease, and death. And that is the theme even with Delta variant. Remember, the vaccines are like seatbelts. So they aren't going to protect you from getting into a car wreck. But if you are in the car wreck, it is significantly going to protect you from those worse outcomes, like going through the windshield, like other things as well. That's what the vaccines are doing. A lot of these experiments that are talking about lower efficacy of the vaccine, basically they are just sticking the swabs in people's nose every week looking for positive PCR results. But if you dig deeper into it and not just look at the headline, if you dig deeper, they all continue to say and promote the use of vaccines because they continue to protect people from going to the hospital from severe disease and death.
That's pretty. I like that seatbelt example. That's pretty good. Yeah. You know what I'm going to say? I'm going to quote Dr. Seuss. No matter where you go, there you are, which is a fancy way of saying that the results that you have from a disease are a direct result of your actions around that disease. And you can either believe all the folks who have spent their entire life investigating this, or you can turn to ISIS, the International Society of Internet News, or Internet Science. And we know that that's not a great source, right? We know it's not a great source. And so remember that no matter where you go, there you are. Believe the science so that where you go is to a safe place.
Very simple. I like that. Some of your friends are with us today, by the way.
I know. These are great folks.
So we're going to get to our reporter questions, but I want to go ahead and introduce our guests first before we do that. So joining us virtually today is Dr. Lisa Hays, the new Chief Medical Officer at Advent Health.
Yay.
Yay. Also, Dr. Raghu Adiga, Chief Medical Officer at Liberty Hospital, and Dr. Mark Steele with Truman Medical Centers and University Health. So we are glad you all three are joining us, and you and I will kind of tag team this today.
Yeah,
these are your people speaking your language.
We are people together.
You are. Okay, so do we have any reporters on the line?
We do. Good morning. Cody Holyoke with Channel 9.
Hi.
Cody.
Hi. A couple questions for you, and anybody can answer. We have a lot of people today. Delta, we learned Delta Airlines is charging for health insurance $200 more a month for unvaccinated workers. And I know Dr. Stites had talked about once the FDA gave full approval to a vaccine, we'd start to see other businesses either do that or start requiring vaccines. I'm curious, in our area, are you seeing or hearing of more of this since that development earlier this week?
I've not heard anything more about it. I was reading about the Delta thing well, of course, that's Delta variant with Delta Airlines, but Delta squared. But I was looking at that. There was some reporting coming out, I think it was either in the Wall Street Journal or New York Times, looking at whether or not there is strong legal standing for charging people more because they have a certain health condition, in this case not being vaccinated. So I think that's going to be a little bit controversial. You know, it's a novel approach. They didn't want to do mandates. I think they were afraid they're going to lose part of their workforce. And so they did an increased cost of health care. You know what? Clearly, there is an increased cost of health care. The average Delta hospitalization costs over $50,000. And, you know, the average medical evaluation or medical hospitalization is about $23,000. So, you know what? Delta makes you sick, and it's really an expensive sick. So, you know what? I'm okay with it. I don't know what other companies will do. Just to say, mandatory vaccination has been well established with good legal precedent. So it'll be interesting to see how this goes and unfolds around that. I know a number of organizations that are also requiring their employees who don't want to get vaccinated to be tested multiple times a week. And I think there is that's just good science around it. And especially with the transmissibility of the Delta variant, I think there is some logic to that. So I don't know, that's what I'm hearing. I don't know if anybody else, I'm just gonna look at our panel. Guys, have you heard anything else about that? Because Mark, you all implemented, and now Liberty's implementing mandatory vaccination for your employees. How's that going?
Yeah, good morning, Steve. It seems to be going well. Obviously, we felt this was an important move to take. We took the lead on getting folks tested early on and also getting the vaccines. And so we thought we would do the same with requiring the vaccination for our employees. I think that obviously we have an ethical and professional duty to protect others. And so this is obviously a way to do that. To protect the health of our patients, their families, and the broader community. We obviously, as an academic medical center, feel strongly about the science, as you've already alluded to, and how effective and safe the vaccines are. And now, of course, the Pfizer has been granted FDA approval. I think we all know that we've seen an uptick in our workforce members who are out with either with COVID or having to quarantine, and most of those people are unvaccinated. So that's another reason I think it's important that we have taken this step. And then, of course, as you know, we have other requirements for other vaccines that we already have for influenza and hepatitis B and the like. So I really think it's a very important move, and I hope that others will follow.
Yeah,
Questions?
I think. Well, and so we just ask Raghu, because I know Raghu, you guys you're going that direction in Liberty, right?
No, we've already gone there. Good morning. Thank you for having me. Yes, we started this last Friday, actually announced it. And just like Truman, we felt it's our obligation to our patients, our staff, our families, and our community here in the Northland. And we needed to set an example to other employers around here. And it's going quite well. And of course, most of the feedback has been really positive. And of course, this is an ongoing effort to educate everybody. And there is always going to be some people who have legitimate questions. And we sit with them and kind of explain what the logic is behind that. And it's going very well. And we're proud of our staff for working hard and accepting the responsibility that comes with being a healthcare worker. So it's going well.
All right. Thank you. Dr. Steele just touched on this. He said that there's an uptick in workforce members, people having to quarantine. I'm curious if you guys could go around the horn here and tell us a little bit about that. Is that contributing to the healthcare issues that we're having right now because of the influx of patients?
Lisa, how about up at Advent Health?
Sure. As of yesterday, we had 14 employees out on quarantine currently, and we've seen such a dramatic uptick in people having to utilize our employee health and being tested, and having to wait to hear whether or not they came back positive before being able to go to work. So yes, we are definitely seeing an uptick in employees who are positive.
Mark?
Yeah, no, I mean, I think the answer to your question is, yeah, I mean, it does impact us. I think staffing continues to be a challenge for all of us, and you hear that across the country. So even having relatively small numbers of clinical staff out impacts our ability to staff our beds, and so it's an important element.
And Raghu, how about with you at Liberty?
Yeah, the same thing here. Currently, we have 17 employees who are off work either because of COVID or exposure, and it has steadily climbed up in the last several days.
Yeah, and I know we've been high too, and I think we've been over 50 oftentimes that are off with exposure. Do you know the exact number, Hawkeye, today? Because I don't know the exact number, but it's been elevated and gone up. We have about 12,500 employees, and so we have seen an uptick, and that has been a challenge. And to be fair, not as big a challenge I think as it was last time. We got over 300 people, but I think that largely is because we have so many of our staff vaccinated. But it is still a challenge. And I think the other thing is because we've done a lot better distancing overall and continuing to wear masks, that we're better. But when people go home, which is where folks are getting sick, that's the struggle, and the Delta variant is so darn transmissible. It does affect our ability to deliver care, but the single thing that's really affecting it the most is the number of patients with Delta variant, as well as how busy I think every hospital is right now. That's really the struggle we all face.
Yeah, for our employees for yesterday, there were 65 out in isolation. 36 of those were vaccinated, so less than half, and there were 88 who were being tested. So.
There you go.
But our 7-day rolling average has still been quite a bit higher than it was early in July.
Other questions on the line?
My last question was Governor Kelly ordering state workers to stay home, working remotely till October. With the numbers you're seeing, and like you said, I mean, it's even affecting you guys in healthcare. Do you advise this for other businesses right now? I know a lot of people don't want to go backwards, but do you advise that?
Yeah, that's a great question, and I think it's pretty situational. I think, first of all, there's a better supply of PPE than was the last time, and that was a lot of the driver. Second of all, it depends on your ability to socially distance and be able to keep a masking culture in your office, I think. And then third, I think it depends on what is the job you're trying to do. You know, we brought all our clinical staff back online back here on campus because it was hard to do clinical medicine, even though telemedicine is a huge success. It's not a full replacement for in-person visits in the ambulatory clinics. So I think from a medical standpoint, it's been hard to do that. We still have a lot more people working from home than we ever did. You know, our IT departments and so our billing folks, that's been a great smashing success to be able to work from home. I think that's going to be a permanent change. I don't know that we have not yet modified our course from where it was a month ago, because I think we've kind of hit an equilibrium with where we're going to land. I don't know. Let's ask these guys. Dr. Adiga, what do you think?
Yeah, I think it all depends on the job requirements, as you said. There are certain jobs that are easily doable remotely. I think those certainly, it's time to consider those. In the healthcare, as you mentioned, it's a little bit difficult, but there are certainly other jobs in IT world that can be done from home. I think it's time to consider that.
Yeah, and Lisa, Dr. Hayes, is that kind of what you guys are thinking at Advent?
Yeah, department by department basis, case by case, whether or not, like you said, you can do the work in person, or whether it's safer because of the environment and the type of work to do it from home. So, but yes, we've been making modifications, definitely.
And Dr. Steele?
Yeah, not really anything to add. I would agree with my colleagues, and so really it's kind of department by department.
Any other questions on the line?
Hi, Jordan from Channel 41. Hi, guys.
Hi, Jordan. Hi.
Good morning.
I have two questions. The first one is, Dr. Hawkinson, can you talk about the recent change of having patients who are having surgery being tested for COVID-19 and why you guys decided to change that now and not sooner or later? Or if that's a new change or anything like that?
I think pre-op testing.
Oh, pre-op testing? Yeah, I mean, pre-op testing has kind of gone back and forth with vaccination and not, and there's really not much difference. You know, we're still pre-op testing and screening, unless you've had a vaccine, then we are not really screening you with the pre-op testing, the PCR testing. So, you know, that's really been nothing new. We've really focused on the best way to get you to your procedure. But we know that people with SARS-CoV-2 infection can have a risk of worse outcomes or have complications compared to those that aren't. So, but we are using vaccination status in these cases, and then largely we're also looking at the specific procedure as well, and how risky is it, if you will, or how much risk do you have for adverse outcomes if you do undergo general anesthesia, or how big the surgery is. So a lot of that is also, we are leaving to the individual surgeons as well.
And my next question is, are you guys seeing sorry. Are you guys seeing anyone that has gotten COVID, got the vaccine, and then gotten COVID again?
Okay, so they had COVID, got vaccinated, and now they're sick of, they have another COVID infection. And that's, first of all, the population of patients in whom that's happened is relatively small. Yeah. I can't tell you that I know a specific case. Do you?
I'm sure we have, but again, I don't know any specific cases. I don't think that's unheard of, especially if you, say, had COVID-19 more than a year ago, pre-vaccination, you got vaccinated, and then now again. I think a large amount of this continues to be behavioral, so if you are out in those situations, high risk, and you get it being vaccinated, I think, you know, we've seen those, but there's nothing remarkable about them. They had it early on in the pandemic, pre-vaccination, they got vaccinated, and now over the last, 6 or 8 months, they may have gotten it again, but I don't think there's anything remarkable to speak of unless you have a specific question about that.
Well, let's ask Dr. Adiga, too. Have you seen any of that up in Liberty? Just so our audience knows, Raghu is an infectious disease specialist like Dr. Hawkeye.
Yeah.
Yeah, that's extremely rare, as Dr. Hawkeye said. Yes, I am aware of 1 or 2 patients like that, but they tend to be severely immunosuppressed. The one that I can recall is somebody who's got leukemia and obviously had infection and then got vaccinated, but the vaccine didn't take very well because of the poor immune system that he has, and unfortunately caught the COVID the second time around. But these are all exceptions rather than the rule. So I don't want to, make people think that the vaccine doesn't, help. These are really exceptions.
Jordan, you were going to comment on Jordan's other question. Did you have another question?
No, I think, Jordan, you had two questions, I think.
But you were going to give a follow-up to her.
Nah, I don't remember what it was.
Okay.
Sorry, Jordan.
No worries. It's all good with me.
Okay, thanks, Jordan. Okay, no other reporters on the line, I do not think. We've got some good community questions already coming in.
Can we we're going to talk to these guys for a little bit more?
We are.
Yes,
we are.
awesome.
So I'm going to ask them a couple of questions, and then you can jump in as well. And I'm asking a question that I had that we already have some folks from the community asking as well. And this is to all of the doctors on our panel. It's just, how is the staff handling this surge? What's different this time around for them? Is there anything you all are doing to help them? What is the feel with the staff, and how are they doing? Dr. Steele?
Yeah, well, I mean, this is a challenge for the staff. I mean, we're challenged with getting all the beds staffed, as I mentioned. A lot of the staff are working overtime and working very hard, and this is hard work. The acuity of patients that we're seeing is really high, and I think it's really frustrating to some of the staff that we know that a lot of these, or the vast majority of the admissions are people who are not fully vaccinated, and they know that these are potentially they're preventable admissions, and so it does cause a lot of stress. And so, I mean, but some of the things that we're doing, I mean, of course, we have different wellness groups that are working with us. We've actually created a relaxation room here at our main campus and are working at one at Lakewood to give people a place to go and unwind for a period of time during their shifts. We have, fortunately, very ready access to trauma-informed care providers. We also have been doing some safety and well-being checks on our personnel. And we've also implemented some mental health days for our nurses, and so that they're eligible for 2 of those through the end of this calendar year. So those are some of the things that we're doing, but I think the thing that they would be most happy about is if more people got vaccinated and that they wore masks, and that we can try to get this surge under control.
Dr. Steele, could you share your inpatient numbers with us?
Yes. Yeah. No, currently this morning we have a total of 60 patients between our 2 campuses. 46 of those are active. We ticked up from 52 yesterday. And so our high was 2 weeks ago, Monday, we were at 64. We as of yesterday, I'm going to look this morning, we only had 2 that were admitted who were fully vaccinated. We have 22 in the ICU, 5 of them are on ventilators. We are running very full this morning. We're currently actually holding 9 admitted patients in our ED at our main campus, and one of those is an ICU patient. And we're actually also holding 2 patients in our ED at our Lakewood campus, which is highly unusual. We currently have no open ICU beds, and as I mentioned earlier, our acuity is running really high. We've already had 18 COVID-related deaths in August, and 2 of those patients were in their 30s. Our prior high was back in January. We had 15. And then I think I can't overemphasize our staffing concerns. I mean, that's clearly a challenge for us, but we've managed things so far, but we certainly are worried about the surge in numbers that we're seeing.
Dr. Hays, same question for you about staff and about numbers. What can you tell us?
Sure. I'll start with our numbers because I think they help paint the picture better. Currently, we have 42 active COVID patients. When I started, when I took over the position at the beginning of July, we had 6. We have 8 in the intensive care unit. 5 of those are on ventilators. We have 2 recovering in the ICU and 2 recovering on our progressive care unit. Our main issue continues to be staffing. We have 9 holding in the ED today, and one of those has been waiting over 30 hours for a bed. Basically, the issue is not having enough staff to staff all of our beds. We have available beds, but just not enough staff. As far as employee well-being, that's really an emphasis here at Advent Health. We really do believe our tagline, feel whole. And so we offer a very intensive employee well-being program. We have a licensed clinical social worker who can provide 3 free counseling sessions to all employees. Also, we have a psychologist who's sponsored by our medical staff who offers 6 free counseling sessions to physicians and providers a year. We have 2 Serenity rooms. We have massage services. Last week, we gave away roaming massage services to our 3 of our units who've been particularly just outstanding performers during all of this. So that's really how we're focusing on keeping our employees healthy, both mentally and physically.
Dr. Adiga, same questions to you.
Yeah, at Liberty, again, it's a similar situation. We had 38 patients. Of those, 27 were active. 7 of them were in ICU. All of them were on the ventilator. Out of these 38, 5 were fully vaccinated. All of them were either elderly or with multiple medical problems. Average age is about 53, and 30 out of those 38 were below the age of 65. And again, just like the other hospitals, we are seeing increasing deaths. We've overall so far have had 130 deaths, of which the month of August, which is not over yet, and we've seen the highest 13 deaths so far. In January, we had 11 deaths. And similarly, even our urgent care clinic is also pretty much busy, overrun, averaging well over 100 patients a day. In terms of capacity, yesterday we had 10 patients in the ED waiting for beds for several hours. Today, that's a little bit better, but we have a different problem, which is ICU beds. Currently, this morning, just as I walked in, they were pretty much out of ICU beds, and we have 2 patients going to OR who need ICU beds. So they're scrambling, trying to find. Unfortunately, even our step-down beds are completely taken. So it's quite a process trying to figure out whom to move where and try to get those patients in those beds. So that's been the tight situation. So that puts obviously more stress on those who are working, as you mentioned. Even the deaths have been pretty hard on our ICU staff. They get very close to these patients and families, and puts a lot of stress in addition to workload. And our measures are similar to the other hospitals, trying to help them. But the key thing is we need to reduce the burden on them as much as possible. So this has been a team effort. There are a lot of folks on the non-clinical side who are taking over certain tasks to reduce the burden on them. So that's another way to reduce some of the workload. But again, as the other 2 doctors mentioned, it really is up to the community to do the right things to reduce the pressure on the hospitals. The only way they can do by reducing the number of people getting sick and coming to the hospital is following the infection control guidelines. Get vaccinated, wear masks, keep your distance. This has never changed. And, we need to continue to preach that.
Dr. Stites, as we go down the line, it's the similar story.
Yeah, it's a similar story
everywhere. What can you add as far as capacity and our mortality rate?
Yeah, do we have that graph, guys, on the mortality slide that we can pop up? Yeah, so this just speaks to a mortality rate across different months, and you can see the note in here about August, where we're gonna have a high mortality in August, and it's partly related to census, but I want to pick up on a couple of strands from what we just heard. First, Raghu, so many of your deaths are in people under 65. This is a different thing, guys. This is a new pandemic. We just have to say it like it is. Delta truly is different. The original pandemic was our average age for those patients was 67. Our average now is 63 or 53. This is a different story. And it's a very different story because it is also a difference between the vaccinated and the unvaccinated. The vaccinated age is still old. The unvaccinated age is down around 50, 52, 52. That's really young. And when you have all those deaths, Raghu, and they're all younger 65, that is not who we were losing before. We have lost some, but for the preponderance to be that young is a very distinctly different deal. So I think we have to say it like it is. Delta variant, just think about what's going on. nursing home patients got vaccinated, and that's some of the most sick people there could be. And there's a few of them coming in, but not very many. Nothing like the first time. That is just the absolute proof of how well vaccination works. And the reason that we're seeing people who are 30 and 40 years old dying now with the Delta variant is that's who's not vaccinated. And what you have to realize is that wave of patients didn't get so sick the first time around because the original strain and the Alpha variant were harder to spread. The Delta variant is so much more transmissible. And I think that's the common message we're hearing from everybody, along with we're overwhelmed and we're having a hard time getting our work done because we have patients. We've been waking up at times with 20 or 25 patients in the emergency room. Well, how can you get that done, right? You got to find beds for all those folks. You got to find all the ICU beds. You got to handle your OR schedule. You got to take care of everybody here without COVID. And I think that's a struggle we face. And what we need our listeners to do is to get over the internet arguments and put a mask on because it really does work. And what does a mask do? It says, first of all, I love you because I'm taking care of you. And it also helps us take care of all these other sick patients in the community. Ultimately, when we don't have beds, we can't take the care of the people who need us. And that's what my fear is. And I'm going to look at our panel and ask you guys, I'm betting you're turning down a lot of transfer center patients too. I know we're turning down 60 or 70% of the transfer calls, and we usually accept about 70% of transfer calls. We just don't have beds. Mark Steele, how's it at Truman?
Yeah, I mean, no, when we're this full, obviously we can't accept transfers. And not only that, even yesterday, we had a patient that we were trying to transfer out for a higher level of care, and no one had availability. And so that's a real problem when you can't get people to the appropriate level of care that they need. And so that's really what we're facing.
Lisa, how about add that?
Yeah, so yesterday I talked with our bed control department and had them pull some numbers for me. In June, we declined 54 transfers, mainly because of staffing. This month alone, we've had 192 declined. I mean, it's just astronomical. I heard of a case yesterday that was being transferred from central Kansas, that they basically needed a radiology procedure to handle some bleeding. And we didn't have any bed availability. We didn't have the ICU availability for that. And so they were just going to have to continue to transfuse continuously until they could find a bed available for that individual.
Raghu, Liberty?
Yeah, it's the same story here. It's painful. Yesterday and today, most of our transfers come from up north from smaller hospitals, especially those who do not have intensive care unit capabilities and ability to manage ventilated patients. So it's heartbreaking to talk to them when they call with patients who've been intubated and they need to be in a hospital that can provide that care. And when we don't have ICU beds, it's really hard.
And Jessica, here's the key. Hospitals can't change this. We don't have the power to change this. There's only one group of people who have the power to change it, and that's you. It's everybody out there. You're the ones who can bend the curve. I told you, a long time ago, back in January, I said, look, folks, I grew up in this town. I went to McCoy Elementary School in Independence, Missouri. I went to Truman High School. I went to William Jewell College. I went to Mizzou. I've been at KU for 31 years. We can be KC. And when I say be KC, I mean we have to be the best that we can be. And how do we do that? We have to take care of each other because hospitals can't solve this. Only you can. And the way you do it is you can wear a mask, you can bend the darn curve, get vaccinated so we can stop the curve, right? Wear the mask to bend the curve, get vaccinated, live long and prosper to break the curve. Bend it and break it. Let's do it.
Let's do it.
Bend it like Beckham and break it like, I don't know, whoever.
You'll think of something.
It's going to come to me sometime.
Maybe like Chris Jones will do to the quarterbacks.
That's it. Well, that's right. Yeah, that's right. Sack Nation. Break it like Chris Sack Nation. I like it.
I love your sports analogies.
Yeah.
I keep up with those. Okay, I've got some great questions from the community. Do you have any other questions for our guests?
I'm good right now.
Okay, you're good right now. So a couple of questions came in. One is from Kelly. Maybe it's just also explaining what an actual elective surgery is, but are we going to stop elective surgeries? And I don't some people get confused about what an elective surgery really is.
So an elective surgery is one that you don't have to have because it's not going to, and by the way, this definition is soft, but it is a surgery that you can have, but it's not a life-threatening situation, or it's not an urgent situation. And here's the thing that's happened with most elective surgery. Most elective surgeries tend to have a shorter length of stay. So what we did last fall in January is we took those cases, we expanded our capacity at Indian Creek campus, where we don't do critical care and things like that, to what's called an ambulatory surgery center or a same-day surgery center. We moved those cases by and large off campus to the Indian Creek location so we could get them out of our beds here. So we took a pretty strong stand around that, and we realigned a bunch of resources to get it done, built some more beds, and did things around that. So what's at our main campus now tends to be, there's a few elective cases, but most of them are urgent. What we have done is, because we've not been able to staff, we can staff all of our inpatient beds, we can't staff all of our ORs right now because of just a lack of people. And so we're down from we normally run around, in the main hospital, about 30 ORs, then we have another 10 or 12 over at Cambridge Tower, and we have some over in the Heart Hospital as well. But just on our main, so those are all fully staffed. At the main hospital, we're staffing about 5 or 6 beds less in the operating room. So our OR capacity on this campus is already down because of staffing. And so we actually have slowed down our surgeries, and we've watched our wait times go out a little bit. So have we canceled urgent or elective surgeries? Actually, what we've done is move our elective surgeries off campus. We've reduced our bit of our volume here, so the other elective cases, the ones we can delay, are being delayed already. So there's really not much left to delay. And the problem for us then is, what would you delay? Well, you don't really want to delay the liver mass because that's a cancer surgery. You don't want to delay the terrible back pain because that person's in pain and on narcotics and can't move at home, can't get back to work. So those aren't really elective cases. And so the things that we can delay, we've already delayed. I don't think we have more room in our OR schedule to do that without really doing a disservice to our patients. So I think we've not done that anymore. Mark, what are you doing up at Truman, Dr. Steele?
Yeah, I mean, we have not been postponing or canceling cases so far, but as you point out, I mean, most of the stuff that we're doing is really more urgent or emergent. And so, and then a lot of the elective stuff, a lot of that's outpatient, and the stuff that's inpatient, like you said, has pretty short length of stay. And so, and quite frankly, I don't think that that's going to help us a great deal, even if we started to do that in terms of the overall bed capacity.
Yeah, Lisa, how about it? Dr. Hayes, how about it, Dad?
The same. We're business as usual right now for elective procedures, but we're starting the planning of, what are our reasons to start cutting down on those elective procedures, and certain census with a certain staffing limitations. The problem with shifting those resources is that it takes time to retrain those nurses who maybe were taking care of a different level of care, and then being able to train them to take care of these more critical patients. So it's not like it's a quick fix limiting those elective procedures either.
And Dr. Adiga, Liberty.
Yeah, I agree with Dr. Hayes. I think the competency issues prevent that from really helping a whole lot in terms of capacity. So that is not going to really help us a whole lot. If you think about it, in the last wave, the first wave, I should say, when we had concerns about PPE supply, maybe it made some sense to conserve PPE. But that's not an issue anymore. So there is not a whole lot to gain from canceling all these surgeries that these patients desperately need.
Okay, so I have a question from Jackie. Looking at other countries' history with the Delta variant, what trends do you see that may help us know when to expect this surge to begin to decline?
Yeah, I think it's really difficult to compare countries to each other. We know the vast just land expanse of the United States. That contributes to it. We know the different communities and different cultures within those communities. So I think it's really difficult to understand that. You also have different vaccination rates. I think it's really difficult to predict when this surge or this amount of cases is going to decrease, this amount of hospitalizations is going to decrease, We can't compare ourselves to China, which has other ways of stopping the spread of the disease. We have a larger population than a lot of those European countries. A lot of times we see and cite data from Israel and England, but again, those populations are different. Those land masses are different. I think we just can't compare ourselves to really other countries because we have so many other details that are so different. So I think it's dangerous to do that. I can't predict exactly when. It will change, but I predict it will change in those certain geographic communities quicker than it will change in the United States as a whole, and I think that's what we would see.
Isaac says the hospital numbers have been somewhat stable over the last couple of weeks, or about a month or so. Is that true, first of all? Might we be reaching that plateau or peak?
Yeah, there's some graphing. As we were looking at the stuff last evening that the university works with the health system to construct the data, and there is some flattening of the curve in Kansas City. The problem is it's at a really high level, and in the last day or two, it's actually eked up just a little bit again. And the curve I think that makes the most sense is hospitalizations, because even though that's 2 to 3 weeks delayed from the case rate. The problem with the case rate is that we have no idea what's going on in in-home testing. It's hard to find in-home testing right now. People order it. So when you look at it, you're looking at a PCR, just what people are doing out and they're getting their own tests. The problem is you have no idea what the other part of the equation looks like. And so the downstream variables from that, the one that's most impactful to us is hospitalizations. And our numbers are crawling up, and it's interesting when I listen to the numbers, and I'm just going to go with Dr. Hays, that's a really high number for y'all at Shawnee Mission, I think, and so that concerns me. You guys are up a little bit, and we're good. Dr. Adiga, it felt like you guys had kind of inched back. We'd all kind of dropped a little bit, but now it feels like we're inching back up. I mean, that's 4 for 4 on this call. So just in a real-time thing, we're all back up about 10 or 20% because we did sink a little, but now it's going back up again. And schools are just now opening, right? Schools are just now opening, and universities are just getting back to work, getting back. So I think we're not done with this wave, and I'm afraid this wave is going to stay on this plateau or maybe inch up a little bit more just from the impact of schools. I don't know, guys. Anybody think differently?
I agree, and another way to look at it is not just the new hospitalizations, but the number of people in the hospital. As you know, the COVID patients end up staying in the hospital much longer. So even if the number coming in slows down a bit, the beds taken by the COVID patients still last much longer. The hospital numbers will remain high for a while.
Yeah, Mark or Dr. Hays, any thought?
Yeah, nothing really to add. I mean, I think it's really hard to predict as we've seen, and so. But yeah, right now, I mean, clearly, I think all 4 of us have seen a tick up today, and so what's going to happen tomorrow, we'll see tomorrow.
All right, Ruth is going to get the last question, and I'll hold all your questions for follow-up Friday tomorrow. Dr. Hawkinson, can you speak again to the strength of the vaccine? The booster was 8 months out, now possibly 6 months out. What does that tell us?
Yeah, I mean, again, the vaccine continues to be extremely effective and efficacious at preventing hospitalization, severe disease, and death. I predict even at 12 months, there has been a pivot now to providing the vaccine at 8 months or even shorter, just because not for the cases specifically, but for helping reduce transmission because of everything that we are going on, that is going on now. We have very good recent articles. Again, it's publicly available in the MMWR and Clinical Infectious Diseases journals, which show that even months out from getting vaccinated, although there are cases, those people who are ill are not going to the hospital. It is still protecting you against severe disease, hospitalization, and death. So I think we really need to understand, has there been a pivot now? Are we trying to help reduce transmission more? Because, just getting infected and having a case is not as significant as having to go to the hospital. And so that's what we're doing. These vaccines continue to have cause very good, robust immune responses in those T cells and B cells. There's a recent preprint as well that is not peer review at this point in time, but is going through the peer review process that also shows that after vaccination, your ability to mount that immune response and develop new peak antibodies happens much quicker with getting that vaccine than if you had not seen the infection previously. So the vaccines continue to work to be very efficacious. There may be more of a pivot now to really trying to stop transmission because of everything that we're seeing in the hospital, because of what you heard our CMOs talking about now with hospitalization and capacity and all that. So overall, the vaccine continues to be very good, very effective at protecting people from going to the hospital, going to the ICU, and dying. And I think that data and that robust immune response is going to continue for at least a year. But we also need to look at, well, how can we stop transmission now? Because remember, there is still a large population that has 0% vaccinated, and that is those people under 12. And you just heard Dr. Stites talk about how schools have begun now, and we need to protect especially those unvaccinated populations as well. So the bottom line is the vaccines continue to be very effective. When and if they do call for people to get additional dosing, it certainly could be 6 or 8 months, but it is looking to help stop the transmission because we know that these vaccines continue to provide very good immune response and protection, even past that for hospitalization. And also heard the other day, well, maybe it just may become a 3-dose series at some point. Because we all know that it's going to be difficult to continue to mandate or recommend people getting a vaccine every 6 or 8 months. So, but those things are questions that are unanswered right now that remain to be investigated and answered. But the bottom line is the vaccines continue to provide great protection against going to the hospital, getting to the ICU, getting intubated, and of course dying.
I want to get to our final thoughts from our panel, but I'm going to leave everyone, all 5 of these doctors sitting with me, with this message from Robin. Thank you, doctors, for your commitment to the well-being of our community. I can't imagine the countless hours you have put in during this pandemic to make things work. None of you became doctors to become a media personality, but by doing so, you are saving lives and making a huge difference. You and your staff deserve a standing ovation. You are appreciated.
No, that's really nice, but I definitely didn't do this to be a personality.
Well, maybe Hawk did. I don't know.
Maybe Hawkeye.
No, he didn't.
No.
None of you are. You're very humble, and we appreciate you all, and our guest as well. Final thoughts, Dr. Steele, we'll start with you.
Yeah, well, I just thank you, Robin, very, very much for your kind words. And Steve, it's bend it like Beckham. And so I think we need to try to bend this curve. As a prior former high school soccer player a long time ago, but so we need to bend this curve, and the best way to bend the curve is for folks to get vaccinated who have not been vaccinated. And obviously, in the short term here, we got to have people masked up to try to dampen down this transmission of the virus as it currently is happening.
So you're a soccer player like yesterday then, huh? You're in high school. It's just yesterday for you.
Dr. Hays, final thoughts. Dr. Hays, final thoughts from you today?
Oh, sorry. Yes, just to echo what Dr. Steele said, 95% of our patients in the hospital yesterday who were in with COVID are unvaccinated. 95%. That's totally preventable admissions, totally preventable intensive care visits, preventable ventilator stays, preventable time away from family. We all have to do our part, wear our masks and get vaccinated.
Or don't wear your masks and get ventilated.
That's right. Dr. Adiga, final thoughts from you today?
Yeah, I agree with the other 2 CMOs here. I mean, I think 96% of all physicians are vaccinated. That says something. They trust it for themselves, they trust it for their families, friends, and everybody. So just don't take it from us. You've trusted your physicians for all your healthcare needs all along. So why wouldn't you trust your physicians for their advice on taking the vaccines and masking when necessary when they tell you? And there is no, other hidden agenda behind any of these physicians why they're telling you. So please listen to them, and that'll save you, your family, and your community that you care a lot of grief.
Doctors, thank you so much for being with us today. Come back and see us very soon. Thank you. Dr. Hawkinson, your final thought?
You know, our guest said it best. There's really nothing to add. We will continue to be here, try to provide you with the best information. Please, trust us physicians. You come to us for your cancer care, for other infections, for your surgeries. We have your best interests at heart. If you really want to do your due diligence and look at the data, it is all publicly available. It's not just going on the websites and looking at the headlines, but you can have access. You do have access to these journal articles and the original FDA data and going through that yourself and critically looking at it. So it is all available. Please do that. Please read further than just the headlines, but we are all here to help you, and we will keep giving that message out.
Thank you for that. And now to you.
Oh,
are you
God.
singing today or are you rhyming today?
I'm going to rhyme.
All right, let's do it.
Before I rhyme, can I give 2 quick messages?
Please.
A, for those of you who are young and you're worried about getting vaccinated, our residents, we have about 600 of them. They're between 25 and 30 by and large, and we have a 98% vaccination rate. So no excuses, because our teams are doing it, and they're staying healthy, and they're agreeing with it. So that's a really good thing. Number 2, if you want to find something, the CDC has an app. It's so darn easy to use. You can get all the stuff, and they have both the medical stuff, and they have stuff for folks who aren't medical. So just go take a look.
Good.
Okay, now I'm ready to rhyme.
Do your thing.
I'm ready. You're right.
Okay, let's
Here
show
we
it.
go, folks. I'm going to try and be a rhymer. You've heard me be a singer. Here it goes. And I love Dr. Seuss. I do not want to see your grin. I do not want to see your chin. I do not want to see your nose. I should not see your lips exposed. The lower region of your head should be concealed from sight instead. By the way, these were sent to us by one of our listeners, and so we love these rhymes. They are the best. The next one reads, it's for your sake I wear my mask. Please wear one too. That's all I ask. And the last one says, don't forget to tell your surgeon not to wear a mask next time you need an operation, because apparently masks are ineffective at protecting against germs, and you definitely don't want your surgeon deprived of oxygen. Tell your surgeon, no masks.
Okay, you are reading bedtime stories to my kids from now on.
I love reading those things. It was like one of my favorite things to do.
That's
I like to
good.
make them up sometimes.
I was hanging on your every word. Okay,
Yeah.
we're going to have people start sending in your fun memes. We love those because sometimes they kind of I always say our group around here, we're like kind of memes get us through the day sometimes.
They do.
They just make you laugh and we kind of send them back and
We
forth.
may not be able to show the audience what we send to each other. I think those
Right.
are
No,
the ones we're going to keep.
Yeah, exactly. But yeah, memes that can be shown to the general public. So send those in to us. We love seeing them. We'll show them here and share them. Okay, hey, don't forget about the free vaccination event happening at the City Market this Saturday, 10 to 2. Just look for the KCMO mobile vaccine truck in front of the big paddle wheel down there. Again, it's free. And you can get your first shot. You can also get your second shot. Just remember to bring your vaccination card. So we will see you back here tomorrow at 8 a.m. sharp. It is Follow-Up Friday. Dr. Hawkinson, Dr. Stites will be joining me. So have a great day. Make it a good one.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.